Well, since fellowship is a super specialty, you get to become a master of the branch that you opt for. And once you're a master of the branch, then you have an edge above the others.
Hi guys, and today we have a very special guest, Dr. Divya Singh, a consultant radiologist. Thank you for joining.
Hi Shivam, thank you. It's a privilege to be here.
Okay, and today we have Dr. Divya Singh who pursued a fellowship in Advanced ObGyn Ultrasound. So we'll talk about it and let's begin. So firstly, when can you pursue a fellowship? As in general?
Well, yes. Fellowship is a kind of super specialization. So fellowship is pursued only after doing your post-graduation. So once you've done your post-graduation, then you can opt for fellowship depending on what interests you or catches your eye during your post-graduation.
Okay. And what are the benefits of pursuing a fellowship?
Well, since fellowship is a super specialty, you get to become a master of the branch that you opt for. And once you're a master of the branch, then you have an edge above the others. Not only in terms of the job profile that you would get, but also in terms of the remuneration that you would be offered. Because now you are a master at a particular thing, so you're definitely going to have an edge over your peers who have not super specialized.
Okay, so could you please tell me about your journey of doing the fellowship?
Well, I, during my radiology days, especially when I was doing my senior residency, came to realize that I had an interest in obstetric and gynecological ultrasound, and that is why I opted for a 1-year fellowship in the same. So to do the fellowship, I went to Chennai and worked in a center which had lots of referrals coming from almost 3 or 4 states of South India. So I got to have a lot of clinical experience there. And as a result, I could super specialize and master my skills in ObGyn ultrasound.
Okay. So any highlight of your journey which you would like to share with your juniors who are keen on working in this field?
Well, obstetric and gynecological ultrasound is something which, again, you need to be really skilled and trained with before you start practicing it. And it's, again, very important that you are trained, because often during your radiology days, when you are a PG, you do not get that focused kind of exposure to this branch. You are kind of more drawn towards the more advanced, if I may say so, branches like CT and MR, and you may not focus that much on ultrasound. And especially when you start practicing ObGyn ultrasound, it's very important that you have the right kind of information, because this is one branch of radiology which is very prone to medico-legal litigation. So you have to be really an ace before you start practicing, because otherwise it would not be safe for your patients as well as for yourself.
Yeah, it was a great explanation, and I hope the audience has loved this concept. They must have got a great idea about it. And thank you, Dr. Divya.
Thank you, Shivam. It's a pleasure as always.